Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about the use of ultrasound for refilling intrathecal baclofen pumps. So, as the name suggests, we're using these for refills, and I would consider using them for challenging refills in particular. So, for those that have done refills, there's a refill kit that has this template. And so, what you do is you take the template and you match the outline of the template with the outline or contour of the pump. If you do this correctly, there's a hole in the template that would match up sort of with where the reservoir port is. But in somebody who has more underlying subcutaneous tissue, it can be hard to map out the contour of the pump, and that may be where that ultrasound plays a huge role. So if we're doing this, using the ultrasound for the refill, we want to go through a checklist before I show you the videos. So what the ideal patient position is, what transducer to use, where to start with surface localization, what to identify and pre-scan in the target. So with patient positioning, you want the patient ideally in the examination bed supine, or if transfers are challenging, tilted if they're a wheelchair user. So that's where I like to start. When it comes to the transducer, because the pump is a superficial structure, we want to use a high frequency linear ultrasound probe to get the best resolution. With surface localization, what you can do is you can just identify the location of the pump on inspection or palpation if you know where that surgical scar is. And then you can take your probe and put it in short axis over the pump. And that's a great place to start. And so that's your surface localization. Then with the pre-scan, once you know that you're over the pump, you can translate that probe until you identify the reservoir port. And I'll show you this on ultrasound. Now, if you scan or translate the probe from one side of the pump to the other, and you can identify the reservoir port, then that might suggest that your baclofen pump has flipped 180 degrees. And then once you've identified the reservoir port, and this is sort of my technique. What I like to do is I like to translate the probe so that the port is visualized on the left or right side of the screen with only half of the port visualized. Because what I do is if I get it in that position, I will mark the location of this on the skin where that reservoir port is by keeping my probe on the skin. And so then I can basically take the probe off. I've got the mark, I clean it, I keep the pump fixed, and then I can sort of go through that entry mark, knowing that I'm in the right spot. So here we're going to show you an ultrasound video. So here I am here. We're just going to pause there. And so what we have here is that metallic hyperechoic outline of the pump on the left and on the right side of the screen. And then what we have in the middle here is where our reservoir port is. So where we have that sort of break in the outline with this hypoechogenicity is where that reservoir port is. So that's how you can identify. If you don't see it, then the pump may have flipped. And so once we got that, and I'm just going to sort of fool around the screen, but if I translated my probe more, say, to the left, I would try to get this image here where I have basically the reservoir port taking up half of the far left of the screen. And then if I keep my probe in place, I can mark the skin on the left of the probe, take the probe off, I have that mark, I could clean and do the procedure. So that would be how I do things. So that concludes my video today. I'm the neuromuscular mechanic, and I hope you found today handy. Take care.